Caitlin is perfect because she just illustrates how our kids go from the pediatrician and we don't know when to send our girls to the gynecologist, and they're our babies. So it's really hard to do the switch, and the girls are very anxious about it. Now, as gynecologists, we like our little girls to start at 12 to 13. It's not for an exam, though. And a lot of parents get really anxious about the fact that their kid's going to a gynecologist at 12 or 13, and so does the child. But it's really so that they start getting comfortable with segueing from the pediatrician to the gynecologist, and also to foster that good self-body image, if they have any questions about their bodies, if they have any questions about their periods, because that's how the girls different from the boys a little bit, is that they're going to start to have periods, and what does that mean, and how to protect themselves, and what they can do for hygiene. So it's really important to send your daughter at 12 to 13. Now, that really wasn't that bad, right?
No.
And again, I think a lot of times it's because it's the anxiety of the exam. If you know you're not necessarily going to have an exam, but you're going to talk about your family history, your medical history, any medications, you're going to talk about what you're doing. I want to know what you're involved in. What are your aspirations? What are your goals? I want to know about you so that I can guide your health. Because even though we do certain tests at certain ages, we're trying to treat the patient and not an age or a test number. So it's really important that we know what's going on with you ahead of time. So a lot of times you may think that it's wasting time to have someone come in just to talk to the doctor, but it does so much that we know what's going on with you, where you are in your lifestyle. And again, because like with the sexually transmitted diseases, basically you need an exam anytime you start having sex. You want to get tested for HIV, hepatitis, syphilis, chlamydia, gonorrhea, and occasionally we'll do herpes as well. So a lot of people don't know there's all these tests. There's blood tests and there's cultures. So anytime someone is sexually active. So we want to know the sexual activity, not necessarily the age, because that's happening early and earlier. And get those girls in early, especially for their HPV vaccines, because they can get them 9 to 26. Caitlin's 18, so we talked about that. But really, it's just to talk about you, get to know you, so that we know how to treat you and not an age or a test number.
Okay.
Sound good?
Thank you.